Welcome, everyone. Thank you so much for being here today. Before we do anything, we're going to have everyone set up interpretation. Today we have English and Spanish interpretation, ASL, as well as captioning. So I'm going to bring up Heidi, one of our Spanish interpreters.
Buenos días, buenas tardes a todas y todos. Vamos a dar las instrucciones para acceder a la interpretación. Estaremos proporcionando interpretación simultánea del inglés al español y daré las instrucciones en inglés primero. Good afternoon, good morning, good afternoon, everyone. We are having simultaneous interpretation from English to Spanish and vice versa, and I will be providing the instructions on how to access the channel. In the bottom part of your screen, you will see a globe icon if you are joining us through a computer. If you are joining us through a smartphone or a tablet, you will see 3 dots or the word more. If you click on that, you will be able to see the language interpretation options. We ask for everyone to select the language, either English or Spanish, to be able to hear everyone as they share. We encourage you to mute the original audio so you are able to hear only one voice at a time. We also ask our presenters to speak slowly to be able to capture everything that is said. Having said that, thank you. Let us know if you have any questions. I will proceed with the instructions in Spanish. Buenas tardes, les agradecemos el estar aquí. Las instrucciones para acceder a la interpretación son apretar el globo terráqueo en la parte inferior de su pantalla si nos acompaña a través de un computador. Y si nos acompaña a través de un teléfono inteligente o una tableta, usted encontrará este acceso a través de los 3 puntos o la palabra more o más, si sus configuraciones vienen al español. Seleccione el lenguaje deseado y ponga en silenciador o apague el audio original para escuchar solamente una voz. Al terminar de seleccionar el lenguaje, si está con nosotros a través de teléfono o tableta, necesita apretar la palabra done o terminado para activar la acción. Les pedimos que hablen despacio a la hora de compartir y comuníquese con nosotros si tiene algún percance. Gracias.
Thank you so much, Heidi. Really appreciate your support. Part of our commitment to language justice and collective access. And thank you to our ASL interpreters for being here. We will have them pinned the entire time. Or spotlighted, I should say. This is also captioned. Thank you to our live captioner. If you would like the captioning and it is not showing up, on the bottom of your screen, you should see 3 dots and it'll say more, and you can click on captions and show captions. If it is showing up and it's distracting to you, you can do the same thing and hide captions. The other access note, one is, as Heidi reminded me, we all need to speak slowly and clearly. So I will have to remind myself to slow down. I also want to give a couple instructions for the chat. The chat can be more accessible or less accessible for folks, depending on different disabilities. So use it sparingly. If you have a question or a comment, please put it in the chat. So that we can share that with everyone, but don't put extra comments or hellos in the chat because it may be distracting for some folks. So I think that's all for collective access. If you have other access needs, please put a note in the chat. You can particularly reach out to Ligia and Fiona, who will be helping with our Zoom tech today. So you can chat them privately or everyone in general. All right, so let's bring up Roma, and the 2 of us will get this started. So first I'll introduce myself. I'm Jessica Lehman. I use she and her. I'm the Executive Director of Senior and Disability Action. I'm also a person with a disability. I've used a wheelchair all my life. And Roma, do you want to introduce yourself?
Yes, thank you very much, Jessica. Roma Guy, and today I'm representing Taxpayers for Public Safety. And I'm also, just for honesty and information, I'm a member of the Meta Board, which focuses on aging and disability. And then I was also on the Health Commission when we had the last, what I call transformation at Laguna Honda. And so today I'm trying to partner with community folks to see what we can do for people who are ready to leave, but there's no place, or we think there's no place. And with Jessica, because she's also has relationship with Laguna, that maybe we could come up with some strategies, for the next round with all this.
Thank you, Roma. So as folks most likely know, the crisis of decertification at Laguna Honda Hospital has really raised this issue of long-term care, of how does Laguna Honda fit into our safety net? What services and what housing is available for people who need it? And so we wanted to come together today to really talk about this bigger picture of long-term care options for seniors, for people with disabilities, and people with mental health issues. And to really frame today that this isn't an either-or conversation, right? I think all of us agree Laguna Honda is an important part of our safety net and needs to stay open. And community transitions is an issue that we should always be talking about, right? Seniors and people with disabilities and people with mental health issues often want to have options to live in the community. And so today we're hoping to spark some creative and innovative thinking and problem solving about what might that look like. It might not happen tomorrow, it might not happen next month, but how do we work towards the vision of the kind of community we want? And we know we need to hear directly from disabled people, the people most affected, about their experiences and perspectives. So we'll do some of that today. And just recognizing that this is a really complicated issue. And so really inviting all of you to join us, not only today, but in the coming months and years for collaboration and innovation. Roma, do you want to say anything else?
No, I just think I would just add, in terms of deinstitutionalization, there are perhaps people who are at Laguna today or would end up at Laguna that we need to work with the families or in the relationships that the folks have already to see if they can be diverted from the long-term acute environment or more acute and make it safe for families to support, and who's like IHSS and stuff like that. So I want to include the families for sure, for those where it's appropriate. It's not a one shoe fits all anywhere. Like you said, it's complex, but okay, so what? Life is complicated. Let's go.
Great. So in the interest of bringing in the voices of people directly affected, we have a couple of videos of people at Laguna Honda Hospital talking about their experiences. So give me 1 second to pull this up. And if someone can unspotlight Roma and me while I pull this up, that would be great. Okay, here we go.
Well, my name is Cheryl Bryant. I've been here about 2.5 years. I've had this PD since when I went to my tree. I was at my tree first, and then I came here because they told me it's a better place. Laguna Honda, you know, they told me it's more, you know, activities and, you know. Then when I get here, some of the girls tell me, you only get $50 a month on your check, you know, to survive. But it depends on who. When I came, I had money, you know. My husband was bringing money up here to me, so I didn't have to starve. If I didn't want to eat something, I'd go downstairs, get pizza, you know, burrito. But anyhow, make a long story short, I've been having these dreams about my family and getting back on the streets. But with this disease, it's hard to breathe. And I want the treatment that I can have, that I get here at home. You know what I'm saying? So it's just a biological thing. You know, do what everybody's doing. You know what I'm saying?
What do you envision for yourself, it says?
Me getting out of here, doing, you know, being able to stay alive at home, you know.
What would you need to be able to move into the community?
Like a living nurse that comes every day and makes sure I eat, wash, you know what I'm saying? Just simple things that I usually do. And I feel much better with the air. I feel freer. You know what I'm saying? I feel freer outside. I feel the air. It's like, it gets to be like I'm dreaming and like I'm here. But then I wake up and I'm like back in the same saddle, you know.
What would it be like to be in your own place?
I can have my family visit. I don't know. Do holidays with them. You know, I want Baby back, and I want another one. Baby's my cat.
Okay, I'm sorry. I don't know what happened at the end there to that video. But I want to thank Cheryl for sharing her story. At the end, she was saying BB is her cat, and she got her and didn't know what to call her, and she was Black and beautiful. So she called her BB for Black and beautiful. So thank you for that, Cheryl. All right, so I want to introduce our first speaker for today. We're going to hear from Bill Hirsh, who is Executive Director of the AIDS Legal Referral Panel in San Francisco. And Bill has been an advocate for affordable, supportive housing for people with disabilities for almost 40 years. And we are so lucky to have him in our community. So I'm going to bring up Bill.
Good afternoon, folks. I'm Bill Hirsh with the AIDS Legal Referral Panel. For a number of years, I served on the Long-Term Care Coordinating Council. And I wanted to start my comments by reiterating something that Jessica said, which is that we are deeply appreciative of the commitment that the city and county has made to safety net services for vulnerable populations. And Laguna Honda is a really critical part of that safety net. I think we are all comforted by the fact that that resource is available should we need it. The challenge for many folks is one that I will pose as I posed in many public forums. If you ask people to raise their hands and see how many folks would like to land up in a nursing home, you will probably not be surprised to learn that most folks do not want to land in a nursing home. And in order to avoid ending up in a nursing home, there have to be a couple things in place. First, folks need an income. Second, they need access to stable, affordable housing. And third, they need some services to help them to remain living independently. And what we have seen in the United States in the last few decades is a growing awareness that people want more autonomy in their lives, and people do not want to be consigned indefinitely to institutional care. There have been movements to support independent living that have manifested in a number of ways in different communities, but there are real challenges to getting those supports in place. And for folks who know me, at just about every forum that I go to, I talk about the importance of housing. And that is often the linchpin that is needed in order for folks to remain in the community and get to have some control over their lives so that they can have their cat, they can have their family come and visit them for the holidays, and engage in some of the things that are not available to them when they are in an institutional setting. Now, I know that the city is facing a challenge right now with federal regulation around Laguna Honda, and we are very supportive of their efforts to get back in compliance so that folks can live there free of anxiety that they're going to be placed in the community without appropriate supports. But we are looking today to highlight the reasons why this examination is so important, why we need to put energy up front to make sure that there are resources to support folks in the community. And I will note that San Francisco has had a commitment, but sometimes that commitment is the result of a number of advocacy strategies. And right now I'm going to just focus on one strategy that led to litigation against the city and county in 2008 that forced Laguna Honda to do a number of things. And I'm going to read for a moment right from the press release that came out after the litigation settled. The settlement summary. Among its many provisions, the agreement creates an innovative program to coordinate services across city departments, enabling San Franciscans with disabilities who live at or are referred to Laguna Honda to instead receive community-based housing and services. Eligible individuals will be assessed for, referred to, and provided with subsidized housing, attendant and nursing care, case management, substance abuse treatment, mental health services, and assistance with meals. In addition, several hundred Medi-Cal home and community-based waiver slots which allow people to receive long-term health care in their homes instead of in institutions, will be made available to those who qualify. These waivers should bring millions of dollars in federal and state Medicaid funding to San Francisco. And then perhaps the most exciting component of the settlement was an innovative housing program. There was an agreement for the development of a rental subsidy program through which San Francisco will, over the next 5 years, secure and subsidize scattered site, accessible, independent housing for approximately 500 people with disabilities and seniors who are eligible for community-based services. What we have seen is that the Laguna Honda has made a commitment to assess people as soon as they're entered into the institution about what their plans are and what their goals are to leave that institution. But we need to continue to put pressure on the city to make sure that there are those community-based services and housing available to give folks more autonomy. And that's why each year in the city budget process, we push for more funding for housing subsidies for seniors and adults with disabilities. Those housing subsidies are really one of the most effective way for the city to ensure that people can remain in the community and have greater control in their lives. So with that, I will pass it back to Jessica. I hope I provided a little bit of context and some food for thought. Thanks.
Thank you so much, Bill. I'm going to introduce Jensen Caraballo. Jensen serves on the board of directors of the Stacey Park Milburn Disability Justice Fund, and he has long been a disability rights activist and a community leader. And we are honored to have Jensen to talk a little bit about his own experience as well as the movement for deinstitutionalization.
Hi, thank you so much for having me. My name is Jensen Caraballo. I am a 32-year-old disabled person of color. I'm wearing glasses on my face and my background is blurry. I'd like to share my story with you today. When I was 15 years old, I was forced to live in an institution. I was in high school at the time. I spent 7 years locked up in the nursing home. It made me an advocate. When I was making my transition back into the community, I kept being denied community-based services and support for several reasons. For example, I was told I was too young and inexperienced. Then I was told I was too disabled. It took me years to fight that narrative. I requested fair hearings and wrote extensive letters about how I felt my civil rights were being violated as an American. I eventually won with the help of an organization called the Center for Disability Rights. I now live in my own apartment in Rochester, New York. I've been living on my own for over 10 years. I've accomplished so many things in the community. I've had jobs. I've traveled the country. I've gone protesting for disability rights issues and have gotten arrested for engaging in nonviolent civil disobedience. I've done so many incredible things, and I continue to enjoy living in the community. I receive consumer directly services, which allows me to hire, fire, train, and schedule my own aides. I love my life, and my mission in life is to show other disabled people that they can lead independent lives in the community. I also wanted to briefly talk about the deinstitutionalization movement. Advocates have been battling for decades to establish laws and rights that protect people with disabilities from this type of discrimination. The fight is ongoing. Many people are fighting this fight. Grassroots advocacy groups like ADAPT have been fighting for disability integration within the community for decades. And with that, I'll end my story. Thank you for having me.
Thank you so much, Jensen. Really appreciate you being here and sharing that. So we are going to next go to a panel of people talking about what does community living look like? What works, what doesn't? We're going to hear from people with disabilities, people with mental health concerns, and a home care worker about community living. So we're going to start with Elizabeth Grigsby, who is with the Golden Gate Regional Center, a wonderful community leader in San Francisco. She's on the board of the Kelsey, which you will hear more from in a moment. And let me pull up Elizabeth. Here you go.
Hi, everyone. Thank you, Jessica. Hi, I'm Elizabeth Grigsby. I am a rights advocate for all people with disabilities. I work for one of our regional centers, Golden Gate Regional Center, to be exact. They cover San Francisco, Marin, and San Mateo. That being said, I'm also a board member of a wonderful organization called the Kelsey that's developing inclusive housing for all people with and without disability. One is San Jose and one right here, downtown San Francisco, right across the street from City Hall. I do live on my own. I have my own apartment, and I wouldn't want it any other way. I just want to say something. When we're born, if you're born with a disability, you don't have a say say, you can't say, no, I don't want a disability. Take it back. No, you're kind of stuck with it. So you kind of have to go along with what the system gives you. And to be honest, that may not be a whole lot. So we're putting this cycle that says you have a disability. We know what's best for you. Just as long as you follow the rules, you're doing okay. But when I got older, I knew I didn't want to live drinking at home. After my foster mom passed away, yes, my foster mom. So I was already in the foster system. I grew up with my biological parents. So having a disability out of my control, where I grew up was out of my control. So I knew when I got older, I was going to have some control over my life. I was going to be a force to reckon with. So I was like, I heard about supported living, and I really didn't know what it entailed, but somebody from the regional center, to be exact, they told me I would be a good candidate to live on my own. And I was like, heck yeah, sign me up. I want my own place. And when I first moved out, it was really, really hard. But people who know me, they know I love a challenge. You tell me I can't do something, I'm gonna do it anyway, just to prove you're wrong. So I stuck with it, and it was, yes, it was frustrating. It was exciting. It was maddening at times. But you know what? It was worth it. Because why? It was my own place. I could come and go as I please. I could eat what I wanted to. I didn't have to go to bed at a certain time. My workers worked me they get paid not very well, but they get paid to assist me in my own place. And that's what I try to get other people to fight for. Bill said something earlier. Yes, Laguna Honda is a place that people are supposed to go to get rehabilitated. But after they're rehabilitated, they should be able to have the resources and to be able to go back into the community. I'm not knocking Laguna Honda. They're good, but people need to be able to have the choice of where they live and whom they want to live with. And that's why the Kelsey is so important. We're gonna make apartments for people with and without disability, a real community. And for all types of disability, not just DD or IDD. It could be people with mental illness and other disabilities, and the homeless. Everybody encouraged to be a part of the Kelsey. We don't want to exclude anyone.
Thank you so much, Elizabeth. This is Jessica. We really appreciate you sharing your own experience and a little bit about the Kelsey and your point about workers, whether IHSS or privately paid attendants or caregivers, needing to be paid enough to be able to do this work, right? There's a lot of pieces to the puzzle, a lot of work we need to do.
Yeah.
So, and actually, I was going to keep you up. Well, we'll bring you back in a moment because for the three speakers, Elizabeth, and then two others, we're going to have the three of you have a chance to talk to each other a little bit as well. And if folks who are attending have questions or comments, there's a couple things in the chat. If you have questions for Elizabeth or our next two speakers about community living, please put those in the chat or be thinking about them. So next, I'm honored to introduce Avanel Hanley-Mills, who works at the Mental Health Association of San Francisco. And Avanel is the coordinator of Solve, sharing our lives, voices, and experiences, and is a Bay Area transformative guide or coach focusing on mental health recovery. So go ahead, Avanel.
Thank you very much, and I am honored to be here. Like Jessica said, I'm Avanel Hanley-Mills, and they, them. I'm Caribbean of descent with multiracial and ethnic background. I'm wearing tinted eyewear for visual need. You know, this is a very interesting conversation and one that's needed. In many parts of the world, people live together, and as humans, how we function is socialization in one part of the other. And, you know, in the US, the individualization of how we function has become a model. And thinking about community, how do we function as best as we can? And instead of survive, strive in how we live day to day. I do not consider myself someone with a disability. I consider myself someone with abilities, because we all have different types of abilities based on our individual journey. And so I say disability because that's a known thing. However, what I have are abilities. I was diagnosed with a mental health diagnosis of schizoaffective. First it was bipolar, then schizoaffective. And I'm visually impaired. And I was also diagnosed on the autism spectrum of Asperger's, which is no longer a term used. And with those things in mind, I'm over 50. So if my symptoms presented themselves, and it was 50 years ago, I would have been hospitalized with no opportunity to be a participating member of society. And when I was diagnosed with actually all of those things, in my late 20s, I was told that I should stop work, I go on disability, and XXXX. And so even in the medical profession, I was not a valuable member of society, which I already were a valuable member and contributing. But then I was told to do all these things, which means that I'm not saying that other people don't need those things. Though is the idea that we are valued members of the society. And when we're considered valued members, we're treated in that way. And so creating housing, housing already exists. It's how we think about the housing. Communal living has been shown to be very effective socially and culturally. And so creating communal living with a wraparound support, and it does take time. And so with giving everyone that opportunity for housing based on you as an individual. When I was in my most crisis, I was never asked, do you have a home? It was assumed that I was in housing crisis as well. And I wasn't asked, are you employed? I've always been employed in mostly in management. And these are things that helped me to enter my recovery successfully most of the times. But it also motivated me. And giving the opportunity to serve, this is something that's important, to collaborate with our housing needs. When we don't have housing, it adds to our mental health stress. When we don't have the opportunity to serve and be valuable in the community, it adds to our mental health stress. When we do not have a support that's individualized to meet our needs so we can be our successful self, it adds to our mental health stress. And so as we look at what adds to our mental health stress, let's look at how to reduce this mental health stress, individualized, and create housing that support the needs of all of us. We all have our own individual housing. And so for the residents of Laguna Honda, there's individualized and they are valued. Let's put valued at the top of that, so that as we think of how do we support these valuable members of a society, we then increase our compassion and creativity to provide appropriate and long-term housing, and work with the community to provide these housing. Many can go into housing in terms of a shared roommate capacity with support. And like we've said, many of the speakers have said previously, some of this takes time because building a foundation that considers us as valuable takes time because we're not always considered valuable, contributing members of society. So building that framework that we are and the residents of Laguna Honda are valuable, contributing members of society, then we then start to view how we're placing into the community in a different aspect. When someone is considered valuable, then we then change our perspective on how we're treated. And so let's look at being creative in those housing needs, and shared housing is possible. Bring in the community of how they can house individuals and in a shared setting and be successful, and providing that wraparound support. If one cannot work, how can you volunteer? If one cannot volunteer, how can you participate? We can be advocates. We can be many different things, but the opportunity to give is important as well. That gives us value, and it also gives the community value, which we have. And so let's look at all these different areas. When we're getting support for our medical needs, what does that look like? What does that look like to the point of what are we providing for this person to be their better self? That's it. Not to survive, be one's better self. What does that look like? What support do they need? What type of material do they need? What kind of social environment do that person need? And this is how we transition from a closed, non-value environment to an open, healthy, and supportive environment. And I'm going to end here. So thank you. This was enjoyable.
Thank you so much, Avanel. Really helpful to hear from you. Our next speaker on this panel is Berta Ugarte. And Berta is a in-home supportive services, IHSS provider. We are so happy to have you to talk about your experiences providing home care. I want to remind everyone to make sure your interpretation is set up because Berta will be speaking Spanish. So if you have not set up interpretation on the bottom of your screen, or maybe on the side, if you're on a smartphone, look for a globe that says interpretation, or you'll see something that says more with 3 dots, and you can click on interpretation. And if you speak English and you need interpretation from Spanish to English, click on English. And if it's the other way around, click on Spanish. Okay, so I'm gonna hope that everyone just went to your interpretation so you will not miss what Berta has to say. And go ahead, Berta. But you are on mute. Berta, no podemos escuchar.
Puedo escuchar. Ahora.
Gracias. Sí,
How
sí,
about
sí.
now? Okay.
Sí, buenas tardes. Mi nombre es
Good afternoon. My name is Berta Ugarte Noguera. I've been a leader for a very long time. I was helping a lady for 15 years. She passed away last year. I looked after this lady for a very long time. She was very close to me. I loved her so very much. She went to a home after she was hospitalized. She ended up at a hospice. She fell into a depression. When I used to go visit her, because I kept visiting her for an entire year, bringing food for her, I used to do everything that she loved eating, because wherever she was taken to, they don't look after them very well. And so I will take her food and I will help her get her cleaned. She didn't trust many of the employees around there, especially because when they're at a hospice, unfortunately, she passed away out of sadness and out of feeling alone. She was depressed. But again, I kept looking after her for an entire year. I used to bring her food. Every afternoon, I would go there to look after her because she felt like family. I cried. I cried like you can't imagine. Maybe even more than the daughters, not even the sons or children cry for her the way that I did. I looked up to this person for 15 years. Poor thing. Poor thing, she ended up there and she used to tell me, I don't want to be here. And what could I do? I couldn't do anything. I was just an employee. I even did this without pay for a while. I didn't care for salary. Out of the kindness of my heart, I would look after her because I was very sad of for her situation. So I was very hurt that she passed, and the way that she passed, that she was very depressed towards the last years, and she used to beg me to take her out of there, and I couldn't do much for her. I used to beg her children to get her out of there. Unfortunately, she passed away there. And she passed away in my arms because the day that I showed up, that last day, she was in the diner. When she noticed that I got there, I told her, do you want to go to your room? She signaled to me. And so we went to her bedroom. I put her on her bed. The nurse arrived. The nurse didn't really care much for her, but anyway, she wouldn't let go of me. I called her son. I said, your mom, she's not well. I only had 1 hour to be with her, so I had to leave. When she was in the hospital, I used to be able to spend 4 hours with her, but so the son later called me and said that his mother has passed away. And but anyway, the care at Silver was terrible. And towards the end, I was not getting paid. I didn't care for salary. But anyway, I'd say to all the people who are speaking here, do not go to any of those homes. If you need help, I'm happy to go help out because I do it out of love. Yes, money helps, but I do it out of love. I do it out of love. I don't care about the money. And every time I speak about this woman, I cry. This woman died of sadness. She wasn't looked after properly. She felt alone. And every time that I arrived, she was happy. I would clean her up. She trusted me. She trusted me. She didn't trust the staff there because she didn't know them. She was just a number to them. While I took my time with her, cleaning her. So I was gentle, always looking after her with love. So to this day, I get very emotional talking about her. Again, I spent more than 15 years with her and she was always very good to me. And thankfully, I looked after her properly. I hated the way that she passed, and I always went there. she got vaccinated there. And the food there, it's not great. It's not what the patient wants. They feed them whatever they want. So the patient does not enjoy what they're being fed. I used to bring what she liked. While at the hospice, they will give her whatever they wanted. Poor thing. Just to get nauseous just by looking at the food.
A la señora. Por eso les digo, si alguien de ustedes
So
necesita-
again, I tell you, if you need looking after, if you need care, I can look after you with love and treat you well. I don't like mistreating anybody. I have a good disposition. I always have.
Berta, ¿podrías hablar un poquito respecto
Berta, can you please tell us what you think it is best for folks to remain at their homes? I think it's best that folks remain at their place because they get better care. They get better treatment. Nobody will look after them the same way that a person knows you, like personally. If they go to a home, they don't get the same treatment, like the same way that I treated Priscilla. I gave her all my love. I will always remember her. Every time I speak about her, I cry. In June, it will be a year since she passed, and I will be there remembering her. Poor thing. She passed out of depression, out of sadness, because she was very alone in that place. I didn't get paid towards the end. That's okay. And anyway, they don't see the suffering that they are going through. Nadina was great to me, and every person that I looked after, I always looked after with a lot of love. Thank you, Berta. I get so emotional remembering her because I worked with her for 15 years. And anyway, I do speak a little bit of English, just a few words, but I always try to understand my patient. And I treat them like they were like their family, and that's what they need. They need to feel supported. They need to feel understood and not taken to a home. Thank you, Berta.
Thank you so much, Berta. We really appreciate hearing from you. This is Jessica again. We're going to keep you up here, Berta, for a moment, and we're going to bring back Avenel and oops, I think two of us spotlight Avenel at the same time. So I'm going to ask someone to spotlight Avenel and Elizabeth again. So I was going to say, Berta, I think you really highlighted how powerful it can be when there's a relationship between a worker and a person with a disability or an older person, and how important that is. And, I think we heard from both Berta and Avenel and Elizabeth to some extent about how important it is to be connected with people, right? And one issue that has been raised about Laguna Honda or other facilities is sometimes people are living alone and are extremely isolated, and actually being in some kind of nursing home connects them with other people. And I think that's where we end up with a limited number of options, right? And so what does it look like for us to think about how do we make sure people can live in the community and not be isolated, right? That should be possible. So I want to invite folks to share questions or comments on what we heard from Elizabeth, Avenel, and Berta, or if any of the three of you want to make another comment. Oh, and I see Debbie Kaplan from the Mayor's Office on Disability raised your hand. So go ahead, Debbie.
Oh, thank you very much. And thank you to all the speakers. I really feel moved to talk a lot from my own personal experience. And so I'm not going to talk policy so much, although I think there are major policy implications. I'm a person with a disability and use personal care, live in my own apartment. And I find it's very difficult to find people to do who are as wonderful as Berta. And there are times when I really worry. I pay for my interpreters out of my own pocket, my personal caregivers, which is a whole nother issue. Sometimes I just have difficulty sleeping at night because I'm not really sure that I'm going to find people when I need them. And having backups is another huge worry, I think, for many people. The other major problem is, as has been mentioned, it's very easy to get isolated. And my personal experience I'd like to describe is, for many years, probably the past 15 years of the past 2 decades, I was very lucky enough to live in co-housing communities, one in Oakland and one in the Washington, D.C. area. Many of you might not be familiar with co-housing, but there are many communities, especially in California, but other states, that are primarily condominiums, not so much rentals, where the people in the community manage the community themselves, are very close to each other, share a lot of common amenities, including common meals. I lived in one place that was 3 dinners a week that people cooked for each other and signed up to cook, and people signed up to eat. And it really was like living in a small village. This was not a community intended for people with disabilities. But I often think about that model and how that idea of people with disabilities and some without disabilities living together in close proximity in order to have a sense of community. And what can our public policy do to encourage and offer incentives? I also think that if there are more than one person with a disability living in one site, it could be much easier to attract personal care, especially for people who don't need more than like 1 or 2 hours at a time. It's really hard to find people who are willing to travel to come to you when you only need 1 or 2 hours. And so
Thank you, Debbie.
Thinking that that might be a possible model.
Thank you so much.
Oh, sorry.
No, go ahead, Avana.
No, I concur with that because it's actually cheaper too as well. So if you're providing support for several people in one area, the cost is less, and especially in a smaller area. And I also want to, like, someone mentioned that people at Laguna, residents of Laguna Honda, it is a home, yes. And acknowledging that it has been a home for many, and because of many different reasons, and we do want to respect that. And one of the things I think it's important, regardless of the home, the quality of living is critical. When we have healthy quality of living, regardless of where we are, it does, you know, help us in a positive way. So looking at many different models and how are the participants or the residents are functioning. And that's important. And isolation is key as well. We're human beings, and like animals commune together. They travel in herds. And I have a lab, and my lab, whenever she sees any dogs, she wants to play with them. When she see another lab, it's like, oh, a lab, right? Because that's how we function. And so,
I'm sorry, hold on one second. I think we have a problem. I apologize. I think we let in someone who we should not have. So let me just fix our security here. Okay, let me unmute you. Sorry about that.
Yeah, and so communal housing around the world happens formally and informally. From the Caribbean, we have informal communal housing where everyone literally lives together, and it's not always about economics, but it's about being together with family. And that's something I think is important to really look at in terms of housing and, you know, supportive housing funding. So, you know, like stuff like Section 8 sometimes, depending on where you are, will not pay for someone like in a room, in a roommate situation, right? So really looking at the support that one needs for housing and how we can make adjustments based on the needs of that individual. I think Sheila has.
Jessica, you're muted.
Thank you. Look at me having trouble with security. Okay, who is it that has a hand up? Okay, Stephen, go ahead.
Hi, my name is Stephen Spano. I'm a staff attorney at the AIDS Legal Referral Panel. I was curious how the folks on this call, first of all, I really enjoyed this conversation. I really loved hearing about everyone's experience. It's very powerful and I find it very emotional. So thank you all for sharing. I am curious how the folks on the panel, as well as some of the participants, feel about communal living that involves youth. I'm not entirely sure if there is a model for this, but you know, I know that there are transitional age youth that are looking for, you know, space, and I don't know, it was recently raised on a call whether folks with disabilities, and in particularly older folks, would feel comfortable living with transitional age youth. And so I was just curious about the folks on the call that could speak to that.
Any of our speakers want to take that?
I just spoke with Jessica about that earlier in terms of I think it's in Sweden, because Sweden has amazing programs, has a collaborative housing where college age students roommate with seniors. And that's dual value, because we've left a society where our elders are valuable and our youth are also valuable. So placing both together, it's very important. And I think it's with guide and support. Like with anything, I think it's important to look at the model, look at the individuals being placed in that situation, and what asset they bring to each other. I think it has to be very created in a way that is healthy for both parties, but I think it would be an amazing thing to implement into any housing situation.
Thank you. Okay, it looked like we had comments from Sheila or questions from Sheila and Pat. So we're going to take those two, and then I'm going to show another video. So Sheila, go ahead.
Okay, can you hear me now?
Yes, we can.
Thank you. Avenel, if that's how you pronounce your name. I was.
Sheila, if you're talking, you're on.
What?
I can't hear Sheila.
If people can't hear each other, it may be an issue of interpretation. Has everyone set up interpretation?
Okay.
Sheila, did you set up interpretation on your screen? So if you go to the bottom and click on the globe or click on more and choose interpretation, you can choose English.
English. How's that?
There we go. Yep.
Okay.
Thank you.
Thanks, Fiona. I agree with Avenel. I think that college students, even high school students, it should be part of their program that they will have to meet up with a person in a facility or in their own home who needs some conversation, at least on a regular basis. And maybe they could be paid, these young folks, to add to what they're doing, because it's something different for them. So that's what I would like to see.
Thank you, Sheila. Appreciate that comment. I'm gonna also bring up Pat. Pat, go ahead and share your question or comment. Oh, it will not let me unmute you. The wonders of Zoom. There we go.
Can you hear me now?
Yes, thank you.
Oh, okay. Sound like an advertisement. Yeah, about 7 years ago, I worked with in-home support services in a program they had to try to set clients up with people, with providers who would give them the services they need and with whom they could maintain a relationship. And because of that, I frequently went out to Laguna Honda to meet people who were deemed independent enough to live with services in their home. And I would help set up the services for them and find the right person. What I observed about Laguna Honda was that when it compares with other nursing homes, which are just like hell on earth, that this was a really nice place, that it was spacious, it was clean. I thought it was well run. There were activities. The main complaint I heard was that the food was terrible. And that was about the only thing that I heard that was really negative. And there were some people there who did not want to leave, that had become their home and they identified with it and they felt that they got good care, et cetera, et cetera. And of course, there will always be people, for example, people who are quads, who really cannot live independently because the level of care needed is just so tremendous. And I think that Laguna Honda is an ideal place for people that need extreme care. As for living independently, yes, you need a lot of care from people in the community. It depends how disabled you really are as to whether
Hey, Pat,
that is true.
I'm gonna stop you there. Thank you, just so we don't run out of time.
That's true.
Thank you. No, thank you for your comment. I definitely appreciate it. And I think the folks here have really highlighted some of the ways that it can be possible for people with all kinds of disabilities to live in the community. And so I hope we can continue to think really broadly about that. And as far as, people at Laguna Honda or people in other nursing facilities or other long-term care facilities, I think we have some interesting questions about how do people think of themselves, right? That we all as disabled people internalize ableism and think that we aren't capable and we can't do things. And if we don't have models of other people like ourselves living in the community, we don't think it's possible. And it's scary, right? And it can be hard for all the reasons folks have talked about. So I'm gonna share another video from someone at Laguna Honda. If I can ask one of our tech folks to unspotlight all of us. Thank you again to our panel here today. Unspotlight all of us except our ASL interpreter so that we can show the video. Thank you.
Hi, my name is Curtis, and I'm a 34-year-old resident living at Laguna Honda Hospital in San Francisco. And I think that non-disabled residents of San Francisco are given a higher priority than us disabled residents. There's people here that would love to be living out in a community, or at least have a different living arrangement. I think it would be great if we have more options, because some of us don't have family to move back to or can't for one reason or another.
All right, and thank you to Curtis for sharing your story. All right, so we have two more amazing speakers coming up. First, we're going to hear from Kelly Dearman, who is the Executive Director of the Department of Disability and Aging Services in San Francisco. And Kelly has been involved in community work for many, many years, longer than I've known her, and very committed to improving the lives of seniors and people with disabilities. And today, representing DOS, she is going to talk a little bit about some of the programs that currently exist that support community transitions. I also wanted to flag there are so many things that have come up already today, and the group that put this together has already been brainstorming about a part 2 where we can delve a little bit more into the different programs that are available. So Kelly won't be able to go in depth into everything, but it'll be a little teaser for the future. Thanks, Kelly.
Okay. Hi, everybody. My name is Kelly Dearman. I use she, her pronouns. I'm really happy to be here and excited to see some of you who I have not seen in a while. I've been the executive director at DOS for about 1.5 years. So, and before that, I ran the San Francisco In-Home Supportive Services Public Authority. And so Pat, thank you for your comments, really appreciated them. So this is a complicated issue, right? It's complicated, it's political, it's all of those things. So I can tell you a little bit about what DOS is doing, but so that I don't forget, I just want to say that I believe, I was thinking about some of the questions and comments that you all were making. I believe there is a program in San Francisco, and I'll get more details, for people who are, particular older adults, people with disabilities who are overhoused, and they can get roommates and those are young people who will come and live with them. So I know that that is happening now. That's only going to help very few people. Those home match, thank you, Jessica. That's only going to help those who are overhoused, which is very few of us. But I just want to say that that is a program. I also, you all were speaking about intergenerational living, which is super important to me, both professionally and personally. And I just want to highlight Booker T. Washington on Presidio, because over their community center, they have 50 units of housing, 25 of those units will go to transition they're already housed transitional aged youth, and 25 are for low income seniors and people with disabilities. So it really speaks to this idea that you all already talked about, intergenerational living and how important it is. Personally, most of you, because I say it, I swear every time I speak, I live in a house with my parents and my kids and my partner and a cat. And we have lived like this together for, it's coming up on 14 years. My parents are 91 and 87, and my mom has had MS my entire life. And so she has MS and Parkinson's. And so she also needs a lot of care. But I say that because I believe she is still alive today, both of my parents, because we are all here and we are communicating with them every day. And we have other family that comes over to visit, and we have family dinner every night. So I think what that speaks to is isolation. And so wherever people are living, it is super important. Evan spoke to this a lot, that we work on making sure people have community, that they have an opportunity to meet and greet with other people. So in terms of what we are doing, DOS has a clinical and quality improvement unit. It's a small unit of public health nurses, and DOS has partnered with DPH and community providers to create the Community Options and Resource Engagement Team. It's called CORE. It's the CORE team. And the purpose of CORE is to develop a community living plan for Laguna Honda residents who wish to return to the community. And Ria Mercado, one of our staff, leads the CORE team and has been doing that for several years. So the CORE team is a multidisciplinary team, and it consists of key stakeholders, like I said. So we have DOS, DPH, Laguna Honda, IHSS, Behavioral Health Services, Laguna Honda Social Services, and Community Living Fund. That's just to name a few. But the idea being that folks who don't want to live in Laguna Honda, we're trying to access and identify services that are available in the community, and to develop a community living plan so that people who want to leave Laguna Honda are able to do that. And with it all being client-centered, right? So it's all about the person who wants to leave. So, and whether or not the care of the person who wants to leave can be met in the community. So all of those things are important. And as you all have already identified, and you all already know, that then it becomes an issue of finding appropriate housing, or finding housing, period, that is available, accessible, cost effective. All of those things come into play. So while we are working, the CORE team works to transition people out of Laguna Honda. It is a very slow process, because the one piece that we don't have is the housing. So, and okay, that's not the only piece we don't have, because then we also have to make sure all the services are ready and available. And I saw that Eileen Norman, who is the ED at the Public Authority, I'm sure she can speak better to this, but we also have a crisis of caregivers. So we have a lot of folks out there who are needing care and are not able to access it because we don't have enough caregivers, which again, for me, comes back to housing, because people have to move to the farther reaches of California in order to be able to afford it. So I will say for us, for me personally at home, we have to, we do private pay for my mom, and it is a nightmare trying to find caregivers. So, so I am, you know, I understand that this is a big problem. I'm super grateful. I know I'm really lucky to be able to have a place to live with my mom that works for us. But we are also oftentimes cobbling the pieces together so that it works. So, so there are some supportive housing options out there. So we are doing the best we can. And in terms of what, I think I already mentioned them, I'll just mention again, the programs that DOS has some semblance of control over would be the Community Living Fund, IHSS. We help provide congregate meal sites or home delivered meals or home delivered groceries. And then through our ADRCs, there's all of that programming. And then we also have programming for our veterans and their families. So we are trying to do our part to help move people into community living if that is doable and appropriate. But it's just a slow process, so I'm sure sometimes very frustrating. But I really thank you all for being here. I'm getting some great ideas just listening to you. And I am hoping that departments across the city will continue to work more together versus being siloed so that maybe we can make a dent in this problem. Well, I might be happy to take questions.
Thank you so much, Kelly. We're really honored to have you as director of the Department of Disability and Aging Services to talk a little bit about the programs. And as you said, you know, we need a collaborative approach between city departments, community groups, individuals. This is a very complicated problem, and we're not going to take questions right now. I'm sorry, folks. But the question here about which part of the puzzle did we solve first? I think, you know, part of the challenge is that when someone is moving to the community, it has to all be there, right? And yet we don't want to not talk about moving to the community because it's not there yet. And so how do we handle all that is complicated. And as I said, we know we need a lot more attention on what are these programs, where are the gaps. There's folks looking at all the programs that have a waiting list, and that's a problem, right? If it's an issue of money, it is going to be almost always cheaper to support someone with the right services in the community than a nursing home, although then it's getting the federal and state and local government to all work together on that, another complexity. But if it's a question of money, let's figure that out. That's doable. So I want to bring up Micaela Connery, who is the executive director of the Kelsey. And I will let Micaela tell us more about what the Kelsey is. And then if we have time afterwards, Roma Guy is going to make a couple comments, and then we'll have time for a couple of questions and comments from everyone else. Thank you.
Awesome. Thanks, Jessica. And feel fortunate to come after a lot of folks who have touched on a lot of elements of our work at the Kelsey. So hopefully can build on that. Like Jessica shared, I am the co-founder and CEO of a San Francisco-based not-for-profit called the Kelsey. Our mission is to both develop and advocate for disability-forward housing solutions that are responsive to the overlooked and unmet housing needs of people with disabilities, especially people with disabilities who use supportive services. And recognizing that in building disability forward housing, we actually just create better communities and experiences for all people. So we can meet that need and just create a better city for everyone. And I think my role here, and you were fortunate to hear from our board member, Elizabeth Grigsby, earlier. So we are lucky to have Elizabeth, among others, on this call as partners and allies in our work. And I think a couple of the things that I wanted to touch on today as we think about, what role Laguna Honda has played in our community for people with disabilities, and what role it's perceived to be essential to play in the future, through sort of recognizing that, as has been shared today, there's many people who experience Laguna Honda as their home today, but there's many of them who that home was not a home that they necessarily were able to choose, and for many of them who even they choose that home is chosen based on a perception that is their only option, and that it's our job as a community, and mandated in things like the Americans with Disabilities Act and the Olmstead ruling and the HCBS settings rule, that it's our job as a community to make sure that choice for community living is actually a choice, that there are actually those options that exist. And so we break this down at the Kelsey through kind of a couple lenses. I think the first thing we need to think about is we look at when we say, what are we talking about when we're talking about housing?
Micaela, can you slow down for our interpreters, please?
Yes.
Thank you.
Yes. That is one of my challenges. I will work on it. Thank you for the reminder. So I think when we look at housing and disability, we really frame it through housing that is affordable, accessible, and inclusive, and that our programs and our interventions really need to solve for all three of those areas simultaneously. And it's possible to do so with the right policies. And so on the affordable side, what does that mean? We know that people with disabilities are disproportionately likely to live in poverty. We know that people with disabilities often rely on SSI as their sole source of income, which means they cannot afford housing anywhere in the city, let alone anywhere in the country. And so we need to subsidize housing that is affordable and targeted to people with disabilities. And we can do that really in two ways in this city, and in any community. We can do that by providing direct housing vouchers to people with disabilities to help them pay their rent. And we can do so by providing development subsidies to developers to encourage them and ask them to build housing that is targeted at this population at the level of affordability they need. And both are things that the city of San Francisco has explored or is exploring to different levels, but both need to actually, if we are going to fulfill on the settlement of Laguna Honda, and really more importantly, fulfill our role as a city to actually be a disability inclusive community, we need to invest in both of those to make sure that first and foremost, people need to be able to pay rent or get a house where they need to live. And so that's really policy that comes out of the housing infrastructure within our city, and making sure that things like our public, RFPs for public funding for affordable housing in this city explicitly include homes for people with disabilities who use supportive services. And we've talked also about the cost savings in doing so, that right now when somebody lives in an institution, they are essentially receiving a rental subsidy, and that development essentially lives with a development subsidy because we are paying for their housing as part of living in that hospital. And so it has to be the case, and it can be the case, that those costs can be transferred and reimagined within community-based affordable housing models. The second challenge is really, so that's a financing need, which I say all these needs as solvable issues with policies that can solve them. The second piece is really about affordability, accessibility. And that's really going from affordability on the financing to accessibility, really about the built environment. And so how do we design spaces in cities so that people with cross disability access needs can actually get in and around their housing. And that's a design challenge. It's also a zoning and how we think about how we build spaces and how we guide spaces to be created to make sure that cross disability access is achieved. And that includes, we're good at tracking code. True cross disability access is beyond code. It's really about thinking actually about people's experience in the built environment. What are the, when we think about amenities in our spaces, it's actually not just making sure we comply with all code, which we do, but how do we actually make these spaces livable for someone, whether that's livable for a mobility disability, or livable for somebody who uses a Hoya lift, or livable for somebody who has support staff with them 24 hours a day, or livable for somebody with chemical or sound or light sensitivities, and what does the space do for that, for people who use service animals and beyond. And so we really want to think about the built environment from cross-disability access and all the needs that that is. And then the third that I think has been touched on all throughout this is that inclusivity. And that's really about how we operate communities and how people access services and how people access neighbors and community and people once they're actually in their home. And I saw somewhere in the chat, which I think is a really important point, is that we need to make sure that we actively reject the narrative that community living is only possible for a subset of people with disabilities, or community living is only possible for people with disabilities who have quote unquote less support needs. We need to reject that. One, because we know that's not true from talking to people. We also know that that's not what their rights are. People have a right to community living, regardless of their level of support. And that we really need to really question what that assumption is getting at, is the idea that we do not have enough supportive services to support somebody who has needs that require them to have staffing in their home. And the question we should ask is, we do have that because we support that when people are in a facility. And so we have already all agreed that we can support people. We just choose to provide that level of support in one place and not in another. And so we need to hold service infrastructure. And when I say service infrastructure, I'm not talking about providers and direct service professionals. I'm talking about payers and systems. We need to hold those systems accountable for continuing and providing the level of care needed for individuals, regardless of where they live. And if any of you followed Alice Wong's journey. Alice Wong is an incredible disability rights activist and community leader here in San Francisco, who experienced her own health issues that led her to be hospitalized, and then to deal with this very question of moving from the hospital back into her home. And if you read her writing on this, I think her story is unfortunately an example of so many, where her care, they would provide it at an incredible dollar amount if she was in a facility, but that care wouldn't be provided, and transferred if she came home. And so we really need to think about and reevaluate and reposition systems so that we, the sort of term of money follows the person has a very specific specific example in that program, but the concept overall needs to be applied both to services and to housing, so that people's housing costs are met regardless of whether they live in Laguna Honda or in a house in the community or an apartment in the community, and that their service costs get met. And the problem and why we have this assumption that we all here are here to solve, that community living is not possible or not accessible, or an alternative to Laguna Honda does not exist, is because that breakdown between we'll cover the costs here, yet those costs evaporate and the income for those costs evaporates when people move into the community. And so that focus is both possible and necessary as we think about really designing a community living future. And so as we talk now about what is the future of Laguna Honda, perhaps actually, we should be talking about what is the future of community-based disability forward housing in this city, and what are the things that we need to put into place as a city on the housing policy side, on the services infrastructure side, and on the community support side for us to actually create that future, of which Laguna Honda might be an element of that housing infrastructure, but it is not the sole element. It cannot be the sole element, and we have a lot more work to do outside of that to actually build that to be possible. And so I didn't go into a lot about, the specifics of the Kelsey's approach. Liz shared a little bit about our projects. You can find more on that, but I think overall, it's really holding our systems accountable for their roles in meeting these, goals of affordability, accessibility, and inclusivity for our neighbors with disabilities, and building the programs that make that possible.
Thank you so much, Micaela. Really appreciate that. All right, we have a few minutes left. First, I'm going to invite Roma Guy to come up and share some thoughts on all that we've heard today. And then if folks have questions, and I'm going to invite questions as opposed to comments in terms of limited time, please go ahead and raise your hand or put that in the chat. Oh, sorry, Roma. There you go.
Okay, so thank you. Oh, this was really amazing. I'm really inspired here instead of just trying to overcome seemingly impossible problems every day. So I'm inspired by everyone who attended. I'm inspired by the stories, even on video, for people who couldn't be with us. So I think I'm encouraged to develop more educational and expanding the community of solidarity to move forward. And so I would say I'm inspired to do that for sure, as you and I have discussed.
Yes, Roma, we're getting some requests in the chat. We can't hear you.
Can't hear me?
It must be the interpretation problem again. Roma, are you signed up for interpretation on the bottom of your screen?
I did. Okay. I'm really bad at this. Okay.
Just go to the globe or more. And for other folks, if you're signed up for interpretation, what you can also do is, where is it? It gives you the option of mute original audio. If you don't check that box, then you'll hear people even if they're not signed up for interpretation.
I think
I did. Zoom 201 here.
Okay, can you hear me now? I did sign off.
Can someone who wasn't hearing before share if you're hearing Roma now?
If not, okay,
go ahead, Roma.
So I just think we should go on. We need to do expanded educational community solidarity. This is what I would call, and knowing each other in different, I learned different projects today, including what DOS is doing at Laguna, or, all of that, and what's happening at Booker T, which I happen to know a little bit about. And so we all need to know this so we can build an agenda forward. And I want us to build the partnerships for the very limited, I would say, future need for acute long-term care and more community living options, even if the complexities can't all happen today. We have enough here today, never mind in other forums that we do, to really start on doing this or continue doing it with a larger group of allies and partners. I think the opportunity is there. And I really thank you.
Thanks for that, Roma. And thanks for the questions coming in the chat. I think this is maybe a question for Micaela, but someone else let me know if you want to answer this. Karen Fishkin says, aren't you really talking about changes at the federal level? Most of Laguna Honda's funding comes from Medicare and Medicaid and covers in the institution, but not in home, right? So I think partly the question here is, what are things that we can do on the local level? And then related to that, Amber Caldwell says, has anyone seen a model for co-op or cost sharing for families to invest in community and supportive housing, like a timeshare asset investment? Micaela, are you up for starting that?
Yeah, I can try to answer the, I think you're right, Karen. Sorry, I can start my video. I think you're right that a lot of these changes are on a federal level, but I think some of the implementation can happen on a local level. So I think that, if the city of San Francisco, for example, is saying that the reason that we can't close Laguna Honda is because our individuals don't have the services to be able to live in community because of the way Medicaid is structured, then the city can actually hold the federal government accountable for how we can, pilot or demonstrate new things here in the city. Is sort of my perspective on that, if Actually, I'm not sure that's the real reason why we can't close it. But like this is a real opportunity to say, what is holding it back from allowing these individuals to move into homes with their services? And if there is a program, nobody has a better ear. The Kelsey, the city of San Francisco has a lot better avenue to be able to do some of this advocacy work in partnership with community organizations with this project as a case example of why those things are needed. And I can send, there's a lot of parent-funded models, particularly in the intellectual and developmental disability space. I would say that typically they're not integrated models. They're 100% for people with disabilities and typically are not affordable. They're often for families with higher income. So I don't have a specific example to point to, but there are some of those.
Thank you, Micaela. And I think that there's a great point too about there are so many programs that get federal or state funding that we can use on the local level. There's something called HCBA, Home and Community-Based Alternatives. There's California Community Transitions, all the things that we need to talk about in a future event, but a lot of options for programs that we can avail ourselves of if we put in the time and energy and find the housing to go along with it. Bill has a couple other comments. Bill, can I ask you to come up and share those? I'm gonna hope that's a yes. Here you are.
Okay, so I just wanted to refer back to the piece that I read about the chamber settlement, and in that settlement, the city agreed to use several hundred Medi-Cal home and community-based waiver slots, which would allow people to receive long-term health care in their homes instead of in institutions. And the waivers will allow for federal and state Medicaid funding in San Francisco to be used flexibly. It also called for the city to come up with a rental subsidy program that would use local dollars to support folks living in the community. And that was supports for 500 people with disabilities and seniors who were eligible for community-based services. So it is often, I think, a rather Byzantine web of programs to navigate, but it also, I believe, requires political will. And this is a city with a remarkable level of very wealthy folks with a lot of money, and we often end up at the edges begging for crumbs. And we can do this. It is possible. We have done it before, and we can do it again.
Thanks so much, Bill. Stephen, go ahead and I'm gonna have you ask your question.
Oh, sorry. I just finished typing it into the chat, but I will just repeat it.
I'm sorry. Thank you.
No. My question was related to, with regard to the oversight, the accountability piece, as well as the redirection of funding from being in institutional living into home health. I guess I have a question for advocates. To whom do we turn to advocate for change within those systems? Is it DOS? Is it the Mayor's Office of Disability? My question, where can we show up? Because I know it seems to be a ubiquitous problem regardless of which side one is on. In institutional living, folks are left with very few dollars, in order to maneuver in their daily life. On the other hand, there's all these out-of-pocket costs, like I heard folks mention the cost of interpretation, even once they go through the rigorous process of finding support to help. So it seems like there is a dollar problem. That's something that local advocates can do, but I am at a loss to know where we go. What meetings do we show up to whom do we write letters?
Thank you. It's like you were just planted as a segue to what are our next steps. So you've asked the really hard questions. Where do we go from here? That I think our presenters have made a case, not necessarily planned, but have all talked about the need for more funding at the city, state, and federal level for deeply affordable housing, rental subsidies, home care programs, mental health supports, intensive case management, all of the things, right? So if you are ready to go out there and advocate, I think it's talk to your supervisor, right? Talk to a member of the Board of Supervisors, reach out to the mayor, reach out to your representatives at the state level, as well as at the federal level, right? We need change at all of these levels. And I think part of the point of today is that there's the piece of we need more funding for housing subsidies, for example, but it's also we need to get people to think more broadly about what our community could look like and what community living could really mean for people. So just having those conversations on whatever level you can, I think is a big step. And I want to invite people to do that. Share today's event with someone you know, someone you work with, a person with a disability, an older person in your life, whoever it is, right? Help us expand this conversation. I do want to ask, as far as next steps, and then I'll turn it over to Avanel for another comment. I mentioned that we might do a part 2 where we can dig into more of what kinds of programs are out there for home and community-based services. And in terms of advocacy, what do we need to advocate for more funding or more slots for? And how do those work, right? Who qualifies? How do they support people? So I'm going to ask folks to raise your hand. Actually, don't raise your hand. That'll be confusing. Put a quick yes in the chat if you're interested in a part 2 with more details about home and community-based services. Also, the Department of Disability and Aging Services, well, really the Human Services Agency, recently put out a fabulous aging and disability affordable housing needs assessment. And that is going to be heard by the Board of Supervisors. We don't have a date yet, hopefully the end of April. And that's an opportunity to come and weigh in about what you think is needed. And we'll certainly share the link to that if you haven't seen it yet. We heard folks talk about needing higher wages for IHSS providers. You can certainly advocate on the city and the state level for that. I also want to invite people to keep elevating the voices of people with disabilities, older people, and people with mental health issues, right? We heard some painful comments from multiple people about feeling undervalued and ignored. And it's an all too common experience of so many of us with disabilities. So share those stories. We will have videos that folks can share on social media. You can share what you heard today and ask those questions, right, of people you know. Lastly, to keep in touch on this issue, please get in touch with Senior and Disability Action. I'll ask one of our support folks to put the website in the chat. It's www.sdaction.org. You can also email info@sdaction.org if you want to stay in touch or find out more about these issues. And I see a lot of yeses in the chat, so stay tuned for a part 2. And if you're interested in helping put it together or publicize it, please email that as well. So I'm going to turn it over to Avanel for one of our final comments.
Thank you so much. I just want to say, like, as we go about our advocacy, let's think about language. Language does matter. And if we're restructuring and reframing some of the language that we're using, does not say possibilities, it says inabilities. So let's really look at what language we're using. If we're reframing this into the community, bringing in community members to offer housing possibilities and housing creativity, instead of framing who we are as having less, why don't we frame it in terms of our strengths that we bring to the community in grant writing and advocacy? Let's take out the what isn't, and let's bring in what is.
I can't think of a better note to end on. Thank you for that. Let's think about what could be. And I'll just end with a thank you to our ASL interpreters, our Spanish interpreters, our captioner, our Zoom tech support folks, all of our speakers, and all of the participants. We know it's a busy time, and thank you to everyone for taking the time to be here and delve into these really critical issues. We look forward to working with you. So take care and take action. Goodbye.